Good evening, everyone, and thank you for joining tonight's Fear-Free webinar presentation. My name is Stacy Cruz. I'm the National Accounts Manager for Fear-Free, and I'm going to be your webinar host tonight. So thank you all for joining us for Mitigating Fear, Anxiety, and Stress for Dogs in Isolation or Quarantine. Our presentation tonight is brought to you all by our friends at Virox, makers of Rescue. And presenting today will be Dr. Meghan Herron, the Senior Director of Behavioral Medicine, Education, and Outreach at Gigi's, a shelter organization dedicated to improving the lives of shelter dogs. Prior to her current position, she spent over a decade as an associate professor in the Department of Veterinary Clinical Sciences as head of the Behavioral Medicine Service at the Ohio State University Medical Center. She graduated from the Ohio State University College of Veterinary Medicine and became board certified as a diplomat of the American College of Veterinary Behavior after completing her residency at the University of Pennsylvania School of Veterinary Medicine. As a published author and an international speaker, she has given lectures and seminars on behavior around the United States, Canada, Europe, and Australia. Dr. Herron is the lead editor on the book Decoding Your Cat, which is the long-anticipated sequel to Decoding Your Dog, where the ultimate experts, the American College of Veterinary Behaviorists, explain common cat and dog behaviors and reveal how to prevent or change unwanted ones. We're so excited to have you here tonight, Dr. Herron. So on that note, I'll pass it over to you and we'll go ahead and get started.
Great, thank you so much. All right, so we're going to talk about something that's near and dear to me because it always breaks my heart to see these poor dogs confined to a kennel for weeks on end, and it's very easy for them to deteriorate and really become stressed. So it was a pleasure. I was delighted to be asked to present on this topic, very important topic, and thank you to Virox for sponsoring us. All right, so we'll start with some definitions before we move on. So the term isolation to start means we separate and halt movement of an animal who has a confirmed case. So we know they have a specific contagious disease away from other animals that don't have this disease in order to prevent that spread to others. Whereas quarantine is going to separate and halt the movement of an animal who was exposed to a contagious disease. But they're not yet showing symptoms nor confirmed to be positive. And so we quarantine them away from other animals to see if they do become sick and then prevent the spread, because they could potentially be asymptomatic, particularly during the incubation period. So the length of time an animal is going to be isolated or quarantined really depends on the incubation period and the shedding periods of the specific disease that we're concerned about. So typical protocols we recommend for that isolation housing, once we identify that a dog needs to be isolated or quarantined, they're going to be carried in our arms or transported in a crate if they're a large dog to an isolation area. And we're going to be using personal protective equipment, or also popularly known as PPE during the pandemic. We probably all became very familiar with that term. But that's basically personal protective equipment, meaning it is an impenetrable layer of protective clothing or gowns to prevent any of those contagions to get onto our clothing underneath our skin, so that we do not then transfer into other animals we might have contact with later. So we're going to be carrying these dogs in our arms with PPE or transporting them in a crate that can be fully disinfected, where they're going to house them in a kennel or a ward that is physically isolated from our healthy dogs. So there's no way that we can have shared air or shared physical contact with our healthy population of dogs. If this is a vet clinic, that means the dogs that are in a hospital or coming in and out of our clinic. And in a shelter, this means dogs that are in other kennels, either up for adoption or just coming in for intake. We're going to be a completely separate area where these animals are housed. And these dogs are not going to leave this area until either the isolation or quarantine period is complete. So once they're in, that's it. They're not getting walks outside, unfortunately, and they're limited to exercise within the space that you have dedicated to this area. And that PPE is also going to be required for anyone entering that space and interacting with the dogs. So even if they're not interacting with the dogs, if we're going into the space, anything where a dog has contacted, we have potential to carry with us outside. So we need to have that protection on at all times within that space. Any items that are going to leave the space must be disinfected. So whether you're carrying in and out a stethoscope, a pen, phones can be a big problem, right? In our parvovirus isolation space, We have Ziploc bags for our phones because you're going to ruin that phone if you have to disinfect it over and over again. So it's also helpful to just have equipment that lives in the isolation area so that you're not having to repeatedly disinfect it if that makes most sense for your clinic. And then this entire area is going to be sanitized when the period ends. Even if you're going to be housing animals with the same disease in that period, you still want to sanitize once those animals are leaving, just to minimize any potential for contagion escaping that area. And any items also used in that space are going to be either sanitized or discarded. So I'll give a few examples of exposure quarantines or isolation that we might do. So if we have a dog, at least in our shelter, with exposure, a known exposure to parvovirus. So it could be that a littermate tested positive for parvo, or a dog housed in the same area, or maybe transported on the same transport vehicle, popped up as positive for parvovirus. And so we have another animal that's not showing any symptoms, but had that known exposure. And we know that the incubation period for parvovirus, it can be up to 14 days. And so this means we have a puppy or a exposed, that they're going to be in quarantine for 14 days. And so this is going to be any puppy under 5 months of age is automatically quarantined. If they're over 5 months of age, then we can titer them. And so if they have a positive antibody titer, that does allow them to avoid quarantine, particularly if they don't have a DHPP vaccine in their system for at least 7 days, then we are likely going to be quarantining these dogs. If during this quarantine period they become symptomatic, then they're going to be tested for parvo, and if positive, then they're going to start their isolation period. And that isolation is going to last until their clinical signs resolve and their stool snap negative for at least 2 days in a row. At that point, and this is sort of a recent decision we've made, we're going to fully bathe, scrub, trim their toenails, change into clean, new personal protective equipment, and remove them from isolation, and then limit their exposure to unvaccinated dogs or puppies under 6 months of age for 2 additional weeks. So we have to be careful because there's some debate about how long, whether dogs have the potential to shed parvo once their clinical symptoms are normal. We're currently collecting data we're snap testing every recovered parvo puppy to see if they're popping up positive through a fecal snap test after that. So, but again, this is what we're doing now. They're clearly, depending on your shelter, if you are a high risk for parvo and you have limited abilities to provide safety from your other population, then your exposure might be a lot stricter than this. Well, let's say we have a suspect for ringworm. So we have an animal, a dog with a lesion that looks highly suspect for ringworm. We're going to isolate them until our test results confirm infection. Unfortunately, the test for ringworm isn't immediate, and so we're still going to isolate them if they are suspect, just to be on the cautious side. Once that test result comes back, if it's confirmed to be ringworm, we're going to start treatment, and we're going to continue their isolation for until we have 2 consecutive weekly negative PCR tests. So it does take a few days to get those tests back, which is fortunate for these shelter pups, but in order to protect our other population, that's what we need to do. And if negative, then we can return them to the general population. So on occasion, we do isolate a dog, and we get the results back that it isn't ringworm, and so we can release them from that. But it's still best practice to remove them from general population for something that is contagious, not just to other dogs, but also to people. All right, and so we also have a form of quarantine at our shelter that we call healthy puppy quarantine. And so this is for shelter puppies under 5 months of age, where we try to limit their exposure, or really eliminate their exposure to other dogs and minimize where they are within our shelter if they're under 5 months of age. So we house them with their litter, but we will put on personal protective equipment for all interactions and only walk them in areas that can be fully disinfected both before and after. And so this is really just in case a lot of the puppies that we will take in are coming from other rural shelters that really have unknown backgrounds. So it's sort of like assuming these puppies may have been exposed to parvo, and so we are quarantining them. Usually after 2 weeks, we know that they've been with us through their incubation period, but we kind of keep them in quarantine until they're adopted or reach 5 months of age, just to be on the safe side. All right, so when we're talking about sanitation, disinfection, a couple definitions here, and then just some just some recommendations that we're making based on what's best for the dogs as well as infectious disease control. So the term sanitation means both to clean, as in removing debris, as well as to disinfect, so killing of pathogens. If we just spray disinfectant all over a soiled area, that's not gonna fully sanitize the issue. We actually have to remove the actual debris before we disinfect, so before we're applying our disinfectant. And the disinfectant that we use should be effective against the potential pathogens, and also without adding to the fear and anxiety associated with that isolation experience. So a lot of disinfectants that we might use contain harsh chemicals that have a very strong aversive smell to them. So ammonia-based products, bleach-based products, while they are very effective against potential pathogens, they have a very strong odor that can really be stressful for the animals. And if we're having to frequently disinfect areas, this is going to be re-exposing these dogs to a highly stressful experience. So I'm a big fan of rescue, not just because Virox is our sponsor, but this is what we use at our shelter. It's available in a concentrate that we want to dilute to a ratio of 1:16 with water in order to kill pyrovirus, or if we don't know what the pathogen is, then we want to keep it at that more concentrated ratio. We love that it's available in the wipes, which is very, very convenient, particularly for wiping down stethoscopes or other pieces of equipment. It's a lot easier to use that wipe than to try to soak it or to mop it. All right, so the behavioral challenge of isolation and quarantine. I mean, we know we have limited physical, mental, and social stimulation for these pups. And for our puppies, which comes into play typically with our parvo exposure or actual having parvo, is they're really missing out on critical socialization experiences. And this is going to lead to the development and rehearsal of various fear and anxiety related behaviors. So this might look like excessive attention seeking behaviors like pawing, jumping, barking, other excessive vocalizations like whining, crying, screaming. We can also get stereotypies, which are repetitive behaviors that dogs will sometimes do as a means of coping with high stress, whether they're circling, spinning, walking in some particular pattern. We've seen a handful of these, and the longer those go on, the further they creep towards an actual compulsive disorder that may extend beyond their shelter stay or their isolation stay. So really important that we try to prevent these. And then in some cases, we can have profound fear or worst case fear-related aggression problems develop because they just are not getting adequate outlets for their energy. They're being handled, if they're not being handled in a way that is fear-free, it can provoke fear and in some cases fear-related aggression. Or for puppies who are missing out on that critical socialization and not getting the exposure to different types of people, animals, and places, when they grow up, they have the potential to be afraid of it. And when animals are afraid, they will sometimes use aggression to protect themselves. So really big challenges here when we're isolating animals, particularly if they are puppies. So how do we try to promote positive welfare and preserve positive behaviors despite all of this? Well, the first step is recognizing the signs of fear, anxiety, and stress. And then we look at how we can enrich the heck out of the living environment in isolation, providing both kennel enrichment and interactive enrichment. Then we talk about mitigating environmental stressors and then utilizing psychopharmacology to help, again, preserve the mental state of these dogs. All right, so hopefully this is a fear-free seminar. Most of you are familiar with the fear, anxiety, stress, and frustration scale. I chose to include the frustration scale for shelters in this presentation because I know those of you who are not necessarily in a shelter, if you have isolation or quarantine kennels, you essentially have a setup that is very similar to what a shelter dog might experience. And so I included this scale. And so we will rank these according to numbers. So 0 to 1, a scale of 0 to 1 would suggest a very low level of fear, anxiety, stress, and frustration. So this is, again, what we would always strive for our shelter pets. So these are dogs that are going to be relaxed, maybe very mild signs of stress. It's very difficult not to have any sign of stress in an isolation environment. And we're going to try to prevent this from escalating through our enrichment and daily routines that I'll talk about here in a moment. But when we get to a level 2 or 3 FAS, this is where we're seeing dogs show more moderate signs of fear, anxiety, and stress. So they might be more vigilant. They may be avoiding social interactions. They may be hiding, cowering. Again, those attention-seeking behaviors, barking, jumping, and sometimes their appetite goes down a lot because they're stressed and they're not feeling safe enough to eat. And then worst case, we get to our severe fear, anxiety, and stress levels. So these Our level 4 to 5 dogs, this is where we can see aggression begin, our kennel reactivity, where they're barking, lunging, and charging at people and dogs that are passing their kennel. That barking and jumping, pacing, and spinning, that is really starting to sort of take over their day and consume the behaviors that they're showing, which again, if the longer those behaviors go on, the more mental decline you're going to see in these dogs. So we really need to intervene quickly when we start to see that happen. They're bouncing off the walls, tail chasing, panting, escaping. You're going to see them destroying the bedding or the paper within them. Sometimes they will be biting at the bars of the kennel. I've even seen them start to bloody their paws and hurt teeth in their attempts to escape, because they're really, really struggling and essentially panicking with this confinement and isolation. So hopefully we're keeping our patients in the very low, ideally green levels of FAS. All right, so the first part of enriching this kennel, we can do so from the outside. So we don't necessarily have to be inside the kennel to be providing enrichment to our patients. So we'll often hang a stainless steel bucket outside of the kennel door. Depending on the individual patient, we'll often start with the GI-friendly dog food. We have lots of prescription dog foods that are actually pretty palatable that we'll use as treats. We can also use some of our lean treats or other treats that are less likely to cause GI upset. But many of our dogs, if they're in quarantine for ringworm, we're not worried about their gastrointestinal tract. A lot of them can tolerate much higher value treats that aren't necessarily as GI friendly. You just want to watch the individual patient and cater the individual treats to them. If you are going to use the buckets and leave them out overnight, clearly you don't want to use things that are perishable like bits of chicken or hot dogs unless you're going to be cleaning it out overnight. And also just be aware that we've had problems with vermin. So the mice will clean overnight if there's any treats left over, or we'll empty them out and put them in sealed containers. So we will use these treat buckets both for classical conditioning and operant conditioning. So classical conditioning means creating a positive association, so a positive emotional response with something in their environment. And so we are tossing a little bit of treat into that kennel every time we approach to just teach these dogs that, hey, when someone approaches you and this crazy PPE that you're seeing, good things happen to you. And it just helps them be less and less afraid over time. We can also work on operant conditioning, which is actually teaching a voluntary behavior. And so we might reward a desirable behavior like sit, 4 paws on the ground, or being quiet by waiting for those behaviors before giving our treats. So we'll use these both ways for a lot of our dogs. Then while they're in the kennel, when we can't be with them 24/7, it's helpful to provide an outlet for their time to provide food through food dispensing puzzle toys. Now, this for us is typically in addition to the food that we're going to offer them in bowls. For our parvo puppies, if they are really sick, we are clearly giving them food dispensing puzzle toys if they are NPO, if they're still vomiting. And also keep in mind that for your parvo puppies, once they start to recover, they may not show interest in the puzzle toys if they contain food that they were exposed to when they were feeling nauseated. A lot of food aversions can develop as a result of that. But it just takes some creativity. You can use and reuse. We have cardboard over here. Instead of throwing out our box with our plastic gowns, we can reuse it as something for dogs to make a puzzle out of. And if they shred the paper, we don't really care. If they eat little bits of cardboard or paper, it's typically not a big concern. We can create puzzles out of other boxes, or we can use traditional puzzle toys like Kongs, as you can see with this guy here. So this is the recovering parvo puppy. And it's ideal if we can create the space for them. So this is in our isolation parvo center, and we've got an exercise pen set up so that this puppy, because as you can see, a pretty big dog, pretty big for a puppy, has some room to move and engage. All right, and then we can also take advantage of their meals, making those a little more fun, more enticing, and longer lasting. We can do that by providing their food in slow feeders. We can scatter the food, just the kibble, around the kennel or a larger area, so it takes them more time to scavenge. It's very enriching for their brains to be able to scavenge and work for their food. And then if we can spread it over a larger surface area, it's going to engage them for a longer period of time. We can also provide toys and chews. Clearly, this is going to be something we give under supervision, unless we've done it repeatedly and know that a dog is safe to have a toy or a chew unsupervised. The last thing we want is for them to get a foreign body by ripping these apart and ingesting the contents. All right, and then we look at the overall picture of a dog's well-being and the enrichment we can provide. I like to talk about the triangle of activity, and I call it an inverted triangle of activity because I just can't think of anything better, because it starts with basically the big part, like big activity, movement, moving the muscles, giving that physical stimulation. And then the goal is to, over time, through a series of predictable interactions, we bring them down to a state of calm. So after our physical interactions, if they're getting all jazzed up, particularly these dogs that are isolated and have a lot of pent-up energy, just get them moving their muscles. Again, sometimes we have 5 minutes to do that. If we had 20 minutes to do that, even better. But I recognize that not everyone has that time, particularly in a shelter. But the point is to start there. Start with the physical exercise, get that body moving. Then bring them down to a little bit calmer state by using mental stimulation. And so whether that's puppy push-ups in kennel, teaching them something new, again, depending on whether you can be inside the kennel with them or if you're outside the kennel. But we can be really creative. I'll show you some videos here in a moment. And then providing that one-on-one social time. Now, clearly this is going to require PPE if we're going to be in kennel with them, and whether that physical touch for dogs that really enjoy that one-on-one interaction can be super important, super stress relieving for them. And then we point the end of the triangle by allowing them to have something with which they can self-soothe, so that when you walk away, they are kind of self-sufficient. So whether that's a food toy or a treat scatter, we might vary that a bit so that they have something that's just for themselves and gives them that in-kennel enrichment. And so we can use physical stimulation in kennel, even for dogs that cannot leave. And so depending on the style of your kennel, we have double kennels with the guillotine in the middle. And so it's a little more complicated for these dogs to run back and forth, but we'll play what we call find it. So we'll toss the kibble or treats all the way to the other side, because our kennels are open on top, and the dog will run all the way to the back, and we'll call them back, ask them to sit, say find it, throw the treat again, and get them to go back and forth. So it's a little bit of an obstacle course, and certainly is nowhere near going for a nice jog for 20 minutes. But if we can get them moving those muscles at least for a few minutes, it does provide some level of physical stimulation. It's one of our current puppies. If you know anyone who wants a really cute pit bull guy, you just give me a call. This is Walrus. Trying to get his exercise in by running back and forth. Some are a little slower than others.
Walrus, come on back. Good boy, sit. Boy, sit. Yes, ready? Go find it. Yes, ready? Go find it.
We can also work on basic skills and manners, eat without entering the kennel. So we can do puppy push-ups just being at the kennel side.
Hey, sit. Yes. Shut down. Yes. Sit. Yes. Sit. Yes. Down. Yes, good girl. Sit. Sit.
Okay, so then social stimulation, clearly this is going, typically that they benefit most if we're able to be inside the kennel with them and provide that one-on-one physical contact, which is going to require PPE. Now in this example here, we have scrubs that do not leave our parvo area, so staff will change completely. And then they also cover those scrubs with the plastic gowns and wearing gloves covering their head, wearing bouffants as well as boots. But again, if you didn't have the option to fully change clothes, then you would want to wear the full Tyvek suit so that every inch of your body is covered, because you're having physical contact. You want to make sure there's a barrier between that dog and you're under the clothing underneath. But this is just an example. These puppies just benefit so much from having just a little bit of snuggle time. 15, 20 minutes, just let them have that physical contact. Super good for their socialization as well as their mental state, just to have that one-on-one attention that they're so craving. And then again, the pinpoint of the triangle, giving them plenty of things to self-soothe and entertain once they're inside their kennel and you're leaving them alone. All right, there's also ways we can look at the environment. So different aspects of what they're seeing, hearing, smelling, feeling to help mitigate the stress that they might be feeling in isolation or quarantine. So we can do visual stress reduction in a number of ways. The paper, so we started using this, we have the brown paper, it's fairly inexpensive. You can get on giant rolls and just cut the pieces you need to prevent them from seeing the people or dogs around them. Depending where your isolation or quarantine kennels are, if there are windows or areas where they can see a lot of people passing, walking through, looking in on them, that can be stressful for some of our dogs. And so we put up the paper so that they are sort of buffered from that visual stimulation. In cases where you need to be able to peek in on them, you can do like these other two pictures. These are some kennels at OSU where we can just partially cover so that they have the ability to sort of hide or feel concealed. But if we need to look in on them, we certainly can do so, or we can lift them up to be able to see if we need to do so. We can also use cameras, right? If you're concerned about being able to monitor these dogs, but you still want to provide that visual relief, you can place cameras in the kennels, and then there's different apps that you can use so you can have an eye on them at all times. Auditory stress mitigation. So we have research behind classical music and reggae it being conducive to relaxation in dogs. And so for classical music, we found that decreased barking and increased lying down, and reggae has decreased the time an animal spends standing, as well as decreases their heart rate variability. Again, both of which we equate to a dog being more relaxed. There's a number of ways to get them that music. If you have an overhead speaker, such as Sonos, where you can program which music goes through to them. There's Through a Dog's Ear, which is a compilation of classical music psychoacoustically designed for dogs. So this was created by Dr. Sue Wagner, who is a veterinary neurologist and holistic veterinarian as well. And you can get the eye calms, which will play this. It's a very portable way to do this. And you can use your rescue wipes to wipe these down if needed. We just want to avoid music like heavy metal that's been shown to increase barking, decrease lying down, which we would assume means that an animal's more agitated by this. And make sure whatever you're using as sound stimulation, that they do have quiet time overnight. So they just have a reprieve from all stimulation during the evening hours. If we can, turn off the lights and turn off the music and give them some quiet peace of mind. In order to buffer out sounds that might be coming from other dogs or from the treatment areas that are adjacent to where the isolation kennels are, we can use sources of white noise. This helps create a buffer from those external stressors. Barking is probably the biggest one in a shelter when there's lots of dogs in different kennels that may be barking. So there's you can get them from Amazon, Homedics. This is a traditional on the right-hand side, a traditional sound machine, and that one can be fully wiped with rescue wipes from the whole entire outside to the switch to the cord. So you should be able to use that and still be able to disinfect it fully. When we think of olfactory ways to mitigate stress, so again, I'll bring back to our disinfectant agents. So we really want to minimize harsh chemical scents such as bleach and ammonia products. And so we can use low odor disinfectants such as Rescue, and as well as adding scents to the environment that can be conducive to relaxation, such as lavender and chamomile. So those have been shown to increase lying down behaviors and decrease barking, and which we would equate to a dog being more relaxed. And so we'll have these diffusers, as you see here, in each of our suites that house multiple dogs, and it diffuses into the air with essential oils. And the outside of these can be fully disinfected with rescue wipes. And then we'll also add pheromones for enrichment. So dog appeasing pheromone has been shown to decrease barking and increase lying down behaviors in shelter dogs. And so we could assume that should still have a similar effect to dogs in isolation or quarantine kennels. This is now going to be branded by Thunder Ease. And so Adaptal has purchased the rights to Thunder Ease. And so you're now going to see very few packages marketed as Adaptal. So it says powered by Adaptal, but be on the lookout for the change in branding here. moving forward, SEVA is going to be selling Adaptable and dog appeasing pheromone products through the name Thunder E. So it's the same product, it's just a different label. So don't be alarmed. This is still the good stuff. Just be aware that there are lots of other pheromone products out there that don't have the scientific testing behind them that this specific product does. So while they may work, I don't have science to quote you behind them to say that they are safe and effective. Just remember that your air exchange in isolation and quarantine and shelters is going to be a lot higher than a typical home would be. And so these diffusers may need to be changed every 3 weeks as opposed to every 4 weeks because they're going to evaporate a little more quickly. All right, then touch. So think about what they're feeling. Those sensitive paws, you really want to help them avoid cold and slippery surfaces. Provide them with raised platforms that can be fully disinfected. And then when we are actually putting our own hands on them, to be mindful of using that touch gradient when handling. Those of you who aren't familiar with touch gradient, this is a fear-free concept. We talk about when we're going to touch an animal that we start in an area that is going to cause the least amount of discomfort and is least socially invasive for that pet. And so we can start in an area where they're more comfortable and work our way towards the area that we need to focus on. So for example, if we need to take a rectal temperature, rather than reaching for the tail, grabbing it and popping that thermometer in the rectum, we might start where they're more comfortable. So scratching them on their neck, moving our hands slowly towards the rear end, gently touching their tail, gently lifting it, and then inserting our thermometer so that we can gain that rectal temperature. It just sort of helps work them into that more uncomfortable position by starting where they're more comfortable. And then also part of touch gradient is trying to keep a hand on the animal at all times while working with them, as the starting and stopping of touch as we're working with them and examining them can be jolting and can be stressful and increase their FAS. So trying to keep a hand on them at all times. All right, so moving on, we'll talk about medications, starting with oral medications. Now for fear-free, we often will refer to these as pre-visit pharmaceuticals or PVP. In this presentation, I've just put them as oral medications because this isn't really a pre-visit. This is something where if the animals are going to need this, it needs to be throughout their isolation or quarantine period. And the drugs we're going to use for this situation are going to be ones that need to be immediate acting, so work within 1 to 2 hours. We want them to have anxiolytic properties, not just be tranquilizing. And most of these patients are going to benefit from having these drugs 2 to 3 times per day, so that if they're experiencing FAS throughout their time in quarantine, that's going to be 24/7. So we need to make a plan so that they're getting administration of these medications throughout their stay. And then weaning plans are sent home with the client. So if this is a client-owned dog that is being treated for something and is in isolation, if we're having them on an oral medication throughout their time there, we want to make sure that that client is sent home with a weaning plan. So these aren't abruptly discontinued. In a shelter situation, we'll send home a weaning plan with our adopter, so they're carefully weaning them off these meds and not suddenly stopping them. So here's an example. This is what actually our pre-surgery trazodone dosing, but we'll also use it for isolation and quarantine. And that way we have these charts up all over. And so if a doctor can reach out to a registered veterinary technician and say, hey, I need you to get this dog into quarantine and go ahead and start him on the isolation dose of trazodone or the pre-surgery dose of trazodone. And this is a starting point. So a lot of our pups, we will start them on this dose here, which is low to moderate, and we may discover within the next day or two that it isn't quite adequate. So our dogs that experience higher levels of FAS with that confinement or isolation, we will go higher than this, but this is sort of our nice starting point for these guys. And again, given Q8 to 12 hours. So getting these pups to take the medications can be a challenge in itself. Typically what we recommend is to coat the pills, particularly if they're a bitter tablet, in something sticky. Cover that in something delicious. So here we have peanut butter coating the pill here, and then we have Braunschweiger coating the peanut butter, and then we've rolled the Braunschweiger in breadcrumbs and cracker crumbs so that it has kind of a crunchy texture. Because what can happen is these guys will figure out, if I bite into this, there might be a medication in here, and then they're going to avoid anything. So if we start them off by having crunchy texture in some of the treats we're giving them, they're less suspicious and they're less likely to pick out which one is the pill. And so we create these little meatballs for our pill administration, and we may have to vary what the yummy stuff is depending on the dog's preferences. I talked about giving meds Q8 to 12 hours, which could be a challenge depending on your staffing. And so in order to provide round-the-clock medication, if we want a dog on a medication every 8 hours, we'll put them in a timed feeder. We do have kennels that allow us to place, as you can see in this picture on the right, a timed feeder. This is a timed feeder that typically has a bowl. If you were leaving it at home for your cat or dog to drop food for them, we simply remove the bowl and set the whole timed feeder up on top of the kennel so that this compartment will turn at the time that it's scheduled to do so, and that pill will roll out. Just want to be cautious that it's not rolling under beds or rolling out of a kennel, because that has happened to us on occasion. And then because we're using perishable items in these time feeders, we want to make sure that we are cleaning and disinfecting it, so fully sanitizing it wherever the food has touched every 24 hours, or they can get pretty gross. All right, and in some cases, we need to move on to injectable medications. So for our parvo pups that are vomiting, we're clearly not going to be giving them oral medications, or if the oral meds just aren't cutting it and we don't have a choice. We have a dog that's really panicking with this confinement, and we've got to get them through their isolation period. And so we will reach for injectable medications if necessary. I have a few examples here. And again, there are other options out there. I'm just highlighting what we might use most or what we might reach for in our shelter. So butorphanol provides pain control with mild sedation. Buprenorphine is going to provide a little bit better pain control with mild sedation as well. Midazolam is our anti-panic benzodiazepine. It also has sedative properties. But we may need to add acepromazine for added tranquilization, as some dogs can get a bit of hyperexcitement with midazolam when it's given by itself. Again, if we had the ability of oral meds, we have plenty of options to give with benzodiazepines, but we're a little more limited with our injectables. And then for our super ultra panicked dogs, the worst case scenario, we can get them on an IV continuous rate infusion of dexmedetomidine. So this is for severe kennel distress. Clearly, this is with someone there to be monitoring them. We're not leaving them alone overnight with an IV CRI. So this is going to be for your ICUs, areas that are going to be staffed 24/7. There is some pain control with dexmedetomidine, but I wouldn't rely on it as a sole agent for patients that are having strong visceral pain. But it does provide full sedation, so they aren't necessarily aware of the stress that they might be experiencing, and sort of weather through those really tough days for them until we can hopefully get them onto an oral medication plan. So here's a chart, if that's helpful, just to kind of go through, mild pain, mild anxiety, might reach for butorphanol, and that can be given intramuscularly or subcutaneously. Probably going to need to give it at least Q8 hours if this is a dog that's suffering from continuous pain and anxiety. Again, moderate pain, mild anxiety, buprenorphine. Moderate pain, moderate anxiety, we're going to use that buprenorphine, maybe we may add midazolam. For moderate anxiety without pain, then I might reach for midazolam plus or minus acepromazine if I need additional tranquilization. And then again, that severe anxiety reactivity, we would use a dexmedetomidine IV with monitoring. And if I also had a strong pain component, I might add buprenorphine to that, and just a buprenorphine intramuscular injection as well as that dexmedetomidine CRI. Now, in some cases, we might just give dexmedetomidine prior to procedure. So if we have a puppy in parvo that's really struggling with blood draws, really struggling because we've got to put an NG tube in, or really struggling for whatever we need to do to them to help preserve their ability to be handled by people, we may just give an IV dexmedetomidine injection for that situation. And then allow them to recover. If we need to reverse them, we can. You just have to be aware if you reverse them, then the dexmedetomidine is not going to work potentially for 24 hours. So just being mindful of that. And usually when dexmedetomidine is given IV, it's going to work very quickly and it's not going to last nearly as long. And so as long as you're monitoring them until they're recovering, it should be safe to do so just for procedures. All right, so signs that you're doing a great job, that your isolation and quarantine dogs are coping well. So minimal vocalization, they are engaging with the enrichment that you're providing both in kennel and out. When you are interacting with them, whether you're doing your mental stimulation or your social stimulation, that they have low fear, anxiety, and stress. So they are engaging with you and don't show stress signals being around you, and that they are resting throughout the night. So in the absence of people, in the absence of stimulation, they are able to settle and to rest. Signs that things are not going so well. So despite our best efforts, we have frequent or continuous barking and whining. They're not touching the puzzle toys that we're leaving for them. They are avoiding staff when we attempt to interact with them. We're seeing high levels of FAS, so those levels 4 and 5 with interactions with staff. We have frequent continuous pacing and panting. digging, scratching at the kennel floor, or scaling, climbing the kennel. We have had dogs escape some of our very tall kennels. So ideally we have tops on them, but nevertheless, it's still not appropriate or acceptable if they're making attempts to escape this repeatedly. So if this is happening despite your enrichment, despite your interactions, then it's time to adjust your medication plan, because at this point, you know, you're very limited in what else you can offer them. And so we're looking to psychopharmacology to really help us there quite a bit. Okay, so once we get our dogs out of quarantine or out of isolation, particularly if they are a puppy, we've got to make up for that lost time. I mean, this may have been 2 weeks of their critical socialization period that they missed out on. So remember, the socialization period in dogs is 3 to 12 weeks of age. That's a time where they need to be exposed to people, places, dogs, and have very good experiences so that they aren't then afraid of them later in life. So we just want to be careful that we are making deliberate exposures to people, dogs, new environments, and sounds, being mindful, again, if this is a parvo puppy, that we're not exposing other puppies or non-vaccinated dogs by having them around them, but still trying to get these dogs that experience they so need. We also want to be aware of their fear period. So puppies are in a fear period where they're very susceptible to negative interactions that can create lifelong fears between 8 and 12 weeks of age. And then sometime during adolescence, they have another fear period that lasts 2 to 3 weeks. And it's between 4 and 11 months of age. And it's hard to predict when that's going to happen. So I just recommend handle all of our puppies and adolescents with care. And so when we are socializing these puppies who are already at a disadvantage, we want to make sure that we're not overexposing them or putting them into situations that actually create fear, because we could actually do more damage in our attempts to socialize them. So being mindful of their FAS levels during socialization and making sure that all these experiences are at minimum neutral for them, and even better yet, are positive. So they're experiencing a positive emotion when this is happening. So this is a puppy here. This puppy was my foster dog, and she was under healthy puppy quarantine. She was very timid when we first brought her in. She was emaciated. And so rather than have her spend her quarantine in a kennel, I took her to my house. And then fortunately, my director of training and behavior modification is a sucker and adopted her. So this is her. This is Tig, all grown up. She is a a boxer husky, if you're wondering. You know, after we get these dogs out of particularly parvo, right, where we've been poking them with needles, handling them in ways that we just can't help but to be somewhat uncomfortable and stressful for them, we've got to make up for that. And so I'm going to have Aditi walk us through a little bit of how we can try to counteract some of the FAS they may have experienced during isolation, particularly for parvo.
All right, tutorial on working with dogs that are becoming fractious or cautious about physical handling, medical restraint, and needle pokes. So if you're going into parvo, make sure that you have treats available and on hand, and then have the equipment that you want ready. So I have a syringe here. First thing that we want to do, if we can, is charge up a marker signal with our puppies. So this can be a word yes, or if you want to dedicate a clicker to the parvo treatment center, you could do that too. So how that works is we're going to mark and then present a piece of food. And we do that about 10 to 15 times so that we're classically conditioning that word or sound to a euphoric, feel-good sensation that that dog has, an anticipation that they're going to get something reinforcing. So yes, 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 yes. So she's got that word already charged up in her repertoire anyway. Now when you're working with a puppy who is not wanting to eat, that gets a little bit more challenging. You could try to find places on their body that they like, as far as massage. If they're showing an interest at all in toys, you could mark with the word yes and give them a toy and let them tug on that a little bit, and then present another toy as a trade. So you have to get creative on what that animal finds reinforcing. Next step is, once we have that word or sound charged up, now we're going to start capturing behaviors that we like and reinforcing that, marking and reinforcing. And then we can also start what we call a touch gradient for getting that animal used to restraint, needle pokes, things like that as part of cooperative care. So first step, and Tig is a great example of a dog who generally doesn't like restraint and medical handling, is I'm just going to check in with her and see, can I touch your shoulder and how are you with that? So I touch her shoulder, yes. I mark while I'm touching because I want that to be what she's understanding is what's getting the reinforcement. Touch again, yes. And we want to be able to get some clean loops. And what I mean by that is to be able to accomplish a behavior without that dog wavering at least 2 or 3 times before we maybe increase the criteria. So if she would have shied away or flinched or something when I went to touch her shoulder, I wouldn't then proceed to go down her leg. I'm gonna pause, make sure she's okay with me touching her shoulder before I go down. And I'm gonna make sure that we get at least 2 or 3 clean loops of her not shying away, yes, while I touch her shoulder, before I start to go, can I touch your leg? Yes. So that's how we can start to get down to our touch gradient of yes. Now you can see she flinched a little right there because she doesn't like her paws getting touched. So I'm gonna do a gradient down, yes. That time she didn't flinch. That would be my first clean loop. Yes, second clean loop. And we can even let the dog know, like touching, yes. So they can also know what's coming and we aren't surprising them. So a lot of times I'll do that when I'm also doing a tenting, is I'll do a couple of gradients. So I'm not gonna mark her for this because this is, she's used to this, but when I go to tent her, I'm gonna go tent, yes. And then mark as I'm tenting it, I let her know what's gonna happen, tent, yes. Because then she has a better understanding. Same with when we're presenting tools. If it's a first time, unfamiliar to the dog, we want to at least first just, yes, mark them acknowledging that it is in their environment. Yes. For some dogs, we may even have them nose target it. Yes. So they can touch it themselves. Yes. I'm just going to mark her for acknowledging that it's in her space. Next step would be, I'm not going to go right to a vein. I'm going to say, are you okay with me like touching your shoulder? Yes. And I'm going to speed the process up just for the sake of keeping this video short, but the next step would be, can I come down your leg? Yes. Okay. Can I come down your leg and touch? Yes. Once we've separated coming down her leg with just a hand, and maybe even adding in a twist for the vein, and then separately we've done, can I touch you? Yes. Then we can bring them together with a, can I hold this, touch? Yes. Okay. So this is just to give you an idea of things that you can do with these puppies. Preferably, you also do these things with them when you're not going to be poking them. So the whole point is that we can desensitize them and have also create a positive association that when they see these things coming, when we are touching their legs and touching their ears and lifting their lips, that it's a fun thing, so that those times that we actually do need to poke them and it's going to be unpleasant, we have built up this bank account of really good deposits of positive associations so that we can debit that account now and then, but not bankrupt our trust.
Very good. So again, that was a DDR, Director of Training and Behavior Modification, in her Bosky Tig. And I'm happy to answer questions. I was trying to kind of take a look at them while that video was running, but I'm sure Stacy, you will guide me as to which ones to answer first.
Absolutely. Thank you so much, Dr. Herron. We have several questions that came in, and if anybody in the audience would love to continue putting questions in here, we will take some more of them. A couple of people asked this question, and we did have some very lovely attendees describe it in the chat, but can you explain a puppy push-up?
Puppy push-up, yes, I saw a lot of that. Sorry about that. So the puppy push-up in the video with the second dog in the kennel that I demonstrated is basically a repetition of a sit and then a down and then a sit and then a down. So essentially kind of looks like a push-up where they're going up and they're going down. So it does require the knowledge of sit and down, or the ability or the desire and motivation to be lured into those positions, and that's easier said than done for different dogs. Like the dog I was working with that video, I didn't know she knew anything. I just offered with the lure and used a verbal cue, and she, after a few trials, followed it. Some of these dogs in isolation are so desperate for an interaction that the lure, particularly if we're able to use stinky, highly palatable food, will follow that. But yeah, a puppy push-up is basically a repetition of sit and down and sit and down and sit and down.
I love puppy push-ups. I do them with my puppy all the time, especially days like today when it's raining and we can't be outside, and he loves them. Next question is regarding putting up visual barriers. Is there any chance that could potentially increase FAS since they don't have a choice in seeing or not seeing what's happening on the other side?
I guess I should clarify that we use visual barriers for dogs who are struggling or experiencing FAS with visual stimulation. So it is not automatic that we'll put up a visual barrier. I mean, we prefer to be able to see them, and ideally for them to habituate to the sites that they're seeing passing their kennel. But we can't always count on that. Some dogs will habituate and they'll get relaxed as they see more things outside their kennel. Other dogs will sensitize, and that the more they see, the worse they get. And those are the dogs we're going to intervene and put up a visual barrier, because you're absolutely right. If a dog really wants to be able to engage and see around them, then that can make it worse for them. So you're going to cater that to the individual. I will say for most of our dogs that are becoming reactive or struggling when seeing things and getting stimulated, the visual barrier helps, I would say, in 95% of the cases. You occasionally have one that are like, they're struggling with hypervigilance and the inability to be able to see, investigate, and know what's going on. They're getting upset and they're trying to tear down that paper. That's a dog that I need to intervene with psychopharmacology, because the fact that they are so vigilant, so worried, so concerned that they can't handle a barrier tells me that their level of FAS is too high to begin with. So the visual barrier itself is not going to solve the issue, but I may use it in combination with other enrichment and psychopharmacology. Good question.
The next question here is about audio mitigation. Can audiobooks work for that?
Can audio what?
Audiobooks.
You know, we would think that, you know, there's that's how people talk about how people reading to dogs can be helpful for them. And we have kids come and read to our shelter dogs all the time. We don't have the data to demonstrate that. And, you know, the data really is strong behind classical music and reggae music, but it's certainly possible that other stimulation like soothing voices, spa music, country music, which has been shown to be soothing in cattle, might be helpful. I just don't have the science. And so we tend to stick with either just plain white noise, classical music, or reggae during the daytime hours.
Love that.
And I guess I will add, so in one of the studies where they looked at classical music, they did have a group that had like audiobooks, and basically the recording of people talking, and it didn't have any effect on the dog's behavior, either positive or negative. So at minimum, it should be neutral, but it may not have as much of a relaxing effect as classical music or reggae.
Next question here is, are these mitigation strategies still useful when you're having a high number of adoption returns? So I guess if that animal comes back into the shelter, can we still use these techniques?
Maybe I don't quite understand the question, meaning they've been exposed to it for a long period of time. I mean, we use it regardless of whether they're returned or not. If I'm having multiple returns, I'm going to evaluate why and what's going on with that individual dog. So either have a better placement or reevaluate their adaptability. yeah, and sometimes the whole area, the shelter itself is just too stressful, regardless of how well you mitigate. And if it's a situation where you get them into foster, like with that little puppy, right? It was too much for her to be in healthy puppy quarantine. So I took her to my house because my dogs were vaccinated and I didn't take her out and about anywhere else but my home. So that was a situation where foster was a better option, but that's not always an option. You have a ringworm dog, there's very few people. Occasionally we've had staff members willing, but very few people usually willing to take that into their home and quarantine or isolate.
Next question here is, what's the best way to provide enrichment when dogs are in isolation for aggressive behavior?
Meaning like a bite quarantine?
Yeah.
I mean, I don't think I would change anything. If you need to have protected contact where you're not entering the kennel, I think you would do the same thing, right? Where you can play find it, which is you toss the treat to the opposite end of the kennel and let them come and get it. Now, if they are fear aggressive to people and that's not working for them and that's increasing FAS, then we need to back it up and work on just straight counter conditioning where someone basically sits outside the kennel, does not face them, and is tossing really palatable food like bits of chicken or meat. Just work on getting them comfortable with the sight of people at a distance, and then gradually working to them accepting people being closer and closer until they're able to handle that interaction. And then clearly you're going to need your skilled behavior team members to be working with those dogs. And then psychopharmacology is probably, if we have that situation, I'm going to rely heavily on psychopharmacology to help maintain a calmer state and help them to be in a state of mind where they can learn that people are okay and that they will actually, the process of counter conditioning will actually work for them. Because a lot of these dogs are so aroused, their FAS is so high that they're in a purely adrenaline mediated state where they're really not capable of learning. And so I can utilize psychopharmacology to get them to a better state. And we should be able to administer those medications if we just have to find what they like and what they'll eat the pills in. We should be able to still have protected contact and not put ourselves at risk in administering that medication.
On administering medication, at what age can puppies be prescribed trazodone?
I don't really have a lower age limit. If they are able to walk around, swallow, and digest that medication, then I will use it. So we'll use it for our parvo puppies, whether they're in isolation and quarantine. But I don't have a lower age limit for them, as long as they are, again, so I'd probably say 6 weeks where they can walk around, ingest, and are eating solid food appropriately.
All right. A lot of questions still coming in. For those of you asking, this webinar is counts for fear-free continuing education, and you can add it via your tracker on the fear-free homepage, but it is not for race-approved CE. We've had a couple of questions about that. For those asking when the recording will be available, this recording will be available on the Fear Free Pets website, generally within 2 weeks. We do not typically share the slide deck itself, but the recording should be available. And then we should be able to take 1 or 2 more questions here. It looks like we have a couple more. Right, let's see. All right, for dogs not in isolation, but in the regular kennels, would you consider their stress levels to be concerning if they exhibit behaviors like barking, jumping, but only when other people or dogs are walking through the kennel area?
I think in those few moments, then we want to work on a plan to mitigate that situation. Does it mean they have FAS 24/7 that needs to be managed through psychopharmacology? Maybe, maybe not. It depends how frequently that's being triggered. So if it's a high traffic kennel where there are people and dogs walking past them every 10 to 15 minutes, then I'd say we need to intervene because that is going to snowball into a very big problem very quickly. But if it's just a handful of times a day, those are dogs where I'm getting a treat bucket on the outside of their kennel, so anyone walking by is tossing some delicious food into them. If it's a barking problem, I might have them stand at an adjacent kennel and wait for that dog to be quiet, and they suddenly appear. So we're working on operant conditioning for quiet behavior. But I would say that triangle of activity is going to help for those dogs. So there's a lot of times the barking can be out of attention seeking and frustration. And so the more frustration they have, the more barking you're going to see. And if I can provide physical, mental, and social stimulation for them, then I can hopefully mitigate that frustration so that that desperation for attention isn't so intense. In other cases, it's a fear-related barking where they're becoming reactive. And I'm probably going to work on conditioning them to be less afraid of people approaching. But again, that physical, mental, social stimulation, that triangle is really going to benefit everyone, as long as it's an animal that's safe to handle it and do so.
Thank you so much for all your time this evening, Megan, and all of the questions that you were able to answer. Thank you, everyone, from joining us from literally all around the world here. Any follow-up questions for tonight's webinar can be sent to wags@fearfreepets.com for our team to respond to. Dr. Herron, thank you so much for being our webinar presenter this evening, and thank you to Virox, makers of rescue disinfectants. I did drop the link to that in the chat for everyone, and we hope that everybody has a safe and wonderful holiday season, and we will see you on the next Fear Free webinar. Have a great evening, everyone.
Good night.